Many people who argue about abortion are not quite informed about all the medical information, the process of pregnancy, the development of the fetus, and the procedures of abortion themselves. I worked as a nurse for several years, and so I'm going to take the voice of a medical professional as I go through this information. Primarily, certainly I cannot withhold my philosophical voice as well. But let's think about this and make sure that we're clear on what's going on with fetal development throughout pregnancy. Typically, pregnancies last an average of 39 to 40 weeks. Many of you are familiar with this. But the week count starts at the last day of the last period, and then pregnancies are divided into 3 stages called trimesters. And the first trimester goes for the first 13 weeks. The second trimester is a little shorter, typically considered 14 through 24 weeks, and that's significant with some legal decisions that have been made. And the third trimester would be the 25th week through birth. The medical terminologies for what's going on here is after conception, there is a zygote for the first 10 to 14 days or so. Then the development changes into an embryonic stage for the 3rd through the 8th week, and then technically after that it is a fetus until delivery, and not until after delivery would you call it an infant. Medically speaking, that's what's going on with the development process. Now, at 4 weeks of development, so this is early in the embryonic stage, you do have, of course, this is true of the zygote stage, you have genetic pattern established since conception. You do have heart and eyes and nervous system forming here even as early as 4 weeks. By 6 weeks, you have a more clear distinction of arms and legs. You have skeletal system developing, and there are reflexes that can be noted from the nervous system process. 8 weeks is more significant, and it has become relevant in recent state laws, what's going on in the 8th week. This is the transition period from the embryo to the fetus. And it's at the 8th week that a heartbeat could be detected from an external source by a non-invasive stethoscope. Now, this would be a special fetal stethoscope that you would need, not a regular stethoscope, but it could be heard from outside. And there is brain activity at 8 weeks that's detectable, and you do have fingers and toes that are differentiated. The brain activity is significant because we might have some evidence that the embryo/fetus could feel pain at this point. We're talking about a very small fetus, 2.5 to 3 centimeters is around an inch, just a little more than an inch in size. Now, all systems are in place at this stage. At 12 weeks, the arms and legs have been moving around. The fetus can suck its thumb, inhales and exhales amniotic fluid, so the respiratory system is more active. And the external genitalia show sex differentiation, so on a sonogram, one could detect the fetus, the sex of the fetus. The length is about 8 centimeters, which is approximately 3 inches at this time. At 20 weeks, the heartbeat now is audible with an ordinary stethoscope. The length is around 10 inches or so, 25 to 30 centimeters. There are hair, eyelashes, and at 20 weeks, it has happened that if there was a birth and the mother wanted to try to save the baby, it has happened, extremely rare circumstances, that the baby can survive. At 22 weeks, the survival rate is between 6% and 30%. That continues to improve. That's why the gap here, it's about 30%, where you have the most excellent healthcare available in the world that you could survive. The rate of survival continues then to go up. 25, 26 weeks, it becomes more than 50%. By 28 weeks, there's a pretty good chance, over 90% of survival. And at 32 weeks, with proper care, it's a pretty good expectation that you would expect to survive. Now, in terms of procedures, I'm going to race through this fairly quickly, and you can just pause the video if you want to see the details. The most common procedure is the suction aspiration, or sometimes this is called vacuum curettage, and it occurs in the first trimester. What happens is a suction tube with a cutting edge is inserted into the uterus through a dilated cervix, and then that breaks up the embryo or fetus, depending on the stage, separates the placenta from the wall of the uterus, and the amniotic fluid is withdrawn, and the placental tissue and embryonic or fetal parts are then withdrawn. This is by far the most common abortion procedure. Also in the early stages, a chemical process, at least formally called RU486, where you give 2 different hormones at different stages. The first hormone, mifepristone, is something that then blocks the progesterone, that natural hormone produced during pregnancy. So that causes the nutrient lining of the uterus to disintegrate, and that will result in the death of the embryo or the fetus. And then a second visit, a day and a half, 2 days later, the misoprostol is given, and that initiates uterine contractions, which expels the fetal tissue. Sometimes there's a third visit recommended to verify that the woman is not pregnant anymore. Occasionally, 5 to 10% of the time, the pregnancy still continues, and if the woman still wants to abort, a surgical procedure would be needed at that stage. Now, not everyone takes these 2 to 3 trips to the provider. It is possible to do this without a provider, but of course, much safer to have one overseeing the process. Vacuum curettage and RU486 or other pharmaceutical methods, again, the names, similar process there, but the names of the chemicals are different, are the most commonly used methods for abortion. About half occur before the 8th week, half after the 8th week, about 45% after the 8th week. So that 8th week, again, is an important cutoff stage in terms of development and in terms of how many abortions occur. And very high percentage of abortions occur in the first 12 weeks or the first trimester. That proportion has actually gone down in recent years, so not quite as high as 88%, and then about 7% or so shortly thereafter, but into the second trimester, and then about 5% are well into the second trimester or even in the third trimester. A few more statistics: approximately 20 to 25% of pregnancies in the United States are aborted. That ratio is higher in urban areas, up to 35%, for example, in New York City, much lower in rural areas, for example, less than 5% in states like Idaho or Utah, and approximately 1/3 occur in women in their early 20s. About 0.1% of abortions occur after rape or incest, so that's about 1 in 1,000, which is relevant sometimes for arguments about how laws should be written. Another process later on in the pregnancy is a dilation and curettage, when a cervix is dilated and then a loop-shaped scalpel is inserted to cut up the fetus and remove the placenta from the uterine wall. A dilation and evacuation is used up to 24 weeks, and it's similar to the D&C, except forceps need to be used as well to pull out parts of the fetus, and the skull sometimes has to be compressed or crushed to facilitate its removal because it may be ossifying some at that point. Saline amniocentesis occurs when the amniotic fluid is withdrawn and then replaced with a concentrated saline solution, which will cause the fetal heart rate to stop. And typically about a day and a half or so later, there is a miscarriage or abortion of sorts. Prostaglandins can be used as well. So this would cause the uterine contractions and expulsion of the fetus. And sometimes saline is used so that the fetus is not going to move and make sounds after the expulsion. And then finally, dilation and extraction is a procedure that's sometimes called partial birth abortion. There is a federal law against this procedure, and the law was upheld by the Supreme Court. This is no longer used in the United States in theory, and it would be used after that 20-week period. And what goes on with a dilation and extraction is the physician's guided by ultrasound to grab the leg of the fetus with forceps, pull it into the birth canal, except for the head, and then scissors are used to make a puncture in the back of the skull and enlarge the perforation, and then a suction catheter removes the content of the skull, and the collapsed head is then removed from the uterus. So that's what's going on. It's hard not to be a little bit emotional when you're reading the details of this, which is why it's sometimes called the partial birth abortion, to indicate that emotional response that is natural when one understands what exactly is going on and what motivated lawmakers to make this process illegal in the United States.